namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. This is Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And if you haven't done so yet, then please visit our website to download all of the podcasts that we have available for you. It is absolutely free, and we know that you will find them very helpful and informative. All you have to do is go to hotzepodcast.com. That's Hotze podcast.com. Now, this is a topic that's very near and dear to my heart because I know of so many people who suffer from this. And it is one of the top symptoms that we get here at the Wellness Center when people call and they are suffering from various issues. And that is anxiety. A lot of people suffer from it. If you haven't had issues with it, then maybe it's easy to just think, oh, how bad could that be? However, it's very debilitating for a lot of people, isn't it, Dr. Hotze?
It really is. I want to ask you this. Are you ready to do a 180 and take charge of your health? I believe that you need a health coach. You need a doctor and a staff of professionals who will help you onto a path of health and wellness naturally so you enjoy a better quality of life without using pharmaceutical drugs. Now, today we're going to talk about anxiety. Do you ever feel anxious? Do you ever feel nervous or irritable? Are you scared sometimes for no apparent reason? Do you get panic attacks, a feeling of impending doom? Well, if you do, you would be diagnosed by your conventional doctor as having anxiety. And anxiety is simply a feeling of uneasiness, an irritability, of apprehension.
Maybe even dread.
A dread for no apparent reason.
Mm-hmm.
I used to do emergency medicine years back from 1976 until 1981, and it was not uncommon on a shift to see at least one woman who came in complaining that she couldn't get her breath, she was anxious, she was nervous, and we would give them a prescription of anti-anxiety medication, Xanax or whatever the anti-anxiety. Maybe you give them, no, I never used Valium, but we would give them some sort of anti-anxiety medication, give them a shot and calm them down and send them home. Well, it wasn't until I adopted natural approaches to health that I began to realize that anxiety was just a symptom. Remember, most doctors label your symptoms as your diagnosis. I say most physicians have a disorder themselves called labelitis. That means they take your symptom and they convert that and just say it's a diagnosis. You have anxiety. That's the diagnosis. Well, anxiety is a symptom of an underlying problem. And I want to talk about 5 specific things that can cause anxiety. First is adrenal fatigue. Now, adrenal fatigue is caused when the adrenal gland doesn't make adequate amounts of cortisol. Now, cortisol is your stress hormone, your long-acting stress hormone that your body produces when you're under chronic stress. Stress of raising a family, maybe driving the freeways an hour back and forth from work and heavy traffic. Maybe it's financial. Maybe you've lost a loved one or a mate or a child or a parent. Maybe it's raising a husband, raising your kids. All these things can cause a great deal of anxiety and stress on an individual, at which point a person produces large amounts of cortisol. By the way, if you have chronic pain or chronic allergies, this puts stress on the adrenal gland, and the adrenal gland is producing cortisol for the chronic stress, and it becomes fatigue, just like your muscles would if your muscles produce, as your muscles are exercised, they get fatigued. Lactic acid is produced, and your muscles become sore, and you can't lift anymore or run any farther. So your body produces cortisol to take care of the chronic stress. Now, in acute stress, you make adrenaline. Big football game, you get in a wreck, your heart races, somebody else fire in the house. And, it's that quick rush of adrenaline that is for acute stress, but for chronic stress, your body produces cortisol from the adrenal glands, which are the size of walnuts, sit on top of the kidneys and in your back. You have one on each kidney, so you've got 2 adrenal glands. So if you have adrenal fatigue, this can cause anxiety. And so we can treat for that by simply using natural cortisol in subphysiological doses to support the adrenal gland to make sure you have adequate amount of natural occurring cortisol. The second thing that can cause anxiety is hypothyroidism. When a person doesn't get adequate amount of thyroid hormone from the gland into the cells, it's got to go through the blood. You may have plenty of thyroid in your blood. In fact, 95% of the people always are going to fall in the range of thyroid levels in their blood because that's the way the lab defines what the normal range is. It's as wide as the Grand Canyon, tall as the Empire State Building. Only 5% of the people are going to fall out of range. So you may have clinical symptoms of low thyroid if your thyroid level was optimally here when you were younger. Now it's down here when you're older at 50% the value. You're not getting enough thyroid into your cells. The thyroid hormone that's made by the thyroid gland is predominantly T4, the inactive or very minimally active thyroid hormone. It has 4 iodine atoms. That has to enter the cell. In the cell, it's converted by an enzymatic reaction to T3, 3 iodine atoms of the thyroid hormone. That's the active thyroid hormone, which activates the power plants within your cells to produce energy. Your thyroid gland governs your body's metabolism, the production and use of energy. When a person is low thyroid, their brain makes lower levels of a neurotransmitter called GABA, gamma-aminobutyric acid, GABA, G-A-B-A. And that can cause anxiety. So the treatment, I believe anybody who has the symptoms of low thyroid, which could be one, some, or all of the following: fatigue, difficulty with weight, usually weight gain, cold body temperature, cold sensitivities, inability to focus and think clearly, poor sleep, depressed moods or mood swings, irregular menstrual cycles, joint and muscle aches and pains, dysfunctional gastrointestinal tract, either constipated or maybe irritable bowel syndrome, recurrent chronic infections. Women oftentimes with low thyroid can have miscarriages or inability to become pregnant. They're infertile. They may get recurrent and chronic infections. If you have the signs and symptoms and anxiety and panic attacks and headaches and all these things can go along with low thyroid. If a person has the symptoms of low thyroid associated with the anxiety, I do believe that anybody with these symptoms needs a therapeutic trial of natural desiccated thyroid. Now, so that's the second cause. The third cause can be estrogen dominance, or the other side of the coin is progesterone deficiency. In a normal 28-day cycle, a woman on day 1, or first day of her period, once again begins to start making low levels of estrogen, which build up. And mid-cycle, she will make progesterone. Estrogen's the proliferative hormone. Progesterone is a hormone that matures and balances out the estrogenic effect, so it matures the inner lining of the womb as the estrogen causes the uterus or the inner lining of the womb to beef up and become bulky. Well, the progesterone matures that, preparing the womb for a pregnancy. As women march through their menstrual life, by the time they hit about 35, they make lower and lower levels of progesterone. And estrogen becomes the dominant hormone. Progesterone is deficient. When women hit their early 40s, they oftentimes have anovulatory cycles. They literally don't ovulate. They don't make an egg. And when they don't make an egg, the ovary, which produces both the estrogenic hormones and the progesterone, doesn't make any progesterone at all. And all they have is estrogen hormone. What does that lead to? Well, that leads to longer periods. So periods go from 3 to 5 days to 5 to 7 days and 7 to 9 days. They get breakthrough bleeding. They get fibroids. They get cramping premenstrually. You may have mood swings, fluid retention. You may have weight gain. You may have headaches. You may have migraine headaches that are debilitating. You can have a host of symptoms which fall into the category of premenstrual symptom, for which the pharmaceutical companies give antidepressants and say that's the treatment of PMS. Well, the treatment of PMS is to give low doses, physiological doses of progesterone to balance out the estrogen. And when estrogen is a dominating hormone and the hormones are not balanced, this affects the neurotransmitters in the brains and can lead to anxiety, panic attacks, a sense of overwhelming doom. It can cause a host of problems, apprehension, uneasiness, and women feel this way. Irritability, mood swings. This is very common. And you may have noticed this in yourself, or you may have noticed this in your spouse. The last thing, men, you ever want to ask your wife when she's irritable and blows up at you for no apparent reason, you don't want to ever say, could it be your hormones? You'll ask that question one time. After that, you'll learn you'll never ask that question again. So an imbalance in the female hormones can cause that. In men, a decline in testosterone can cause very similar symptoms. Testosterone affects your initiative, your assertiveness, sense of well-being, self-confidence, mood, goal orientation, drive, directedness, decisiveness, analytical abilities. These are all brain functions. And as men's testosterone goes down, they go through what we would call the andropause. Testosterone levels peak in the early 20s. They fall over a lifetime consistently. So by the time a man is 40, his testosterone level's 2/3 to a half of what it was when he was in his early 20s. By the time he hits 50, it's about half to a third. By the time he's 60, it's a quarter what it was, and it continues to decline.
And that's a good point, Dr. Hotze. It's a slow decline, so men may not recognize that as soon as maybe women
Right.
who have, their monthly cycles. But for men, if it's
can
just
be-
through the years, it's harder to recognize it until it gets more acute.
Men will tell me that I just don't feel as sharp as I used to. I'm not on top of my game anymore. I can't think as clearly as I used to. I feel down. I don't have the drive I used to have. I don't feel as
They're more indecisive.
I don't feel that I'm less confident about what I do. And they have all the experience of life behind them that they've gained through their life, but now they just don't have the testosterone or the drive to make things happen, and they become down and moody and like old curmudgeons. They just become grumpy old men. And testosterone can be profound and have a profound effect on your ability to feel well again and to be able to hit them a lick. And the fifth cause of anxiety can be, in women, the decline in estrogen as they go through the change of life, as they enter menopause, which routinely occurs on an average around 50 years of age. It can happen at an earlier age or at a later age in some women. And as estrogen falls, they get estrogenic symptoms. They get hot flashes. They get night sweats. They get mood swings. They may feel depressed. They have vaginal dryness. They have loss of romantic moods and inclinations. That also occurs with estrogen dominance, by the way. But their estrogen levels begin to decline as their ovaries shut down at approximately the age of 50 when they enter menopause. And that can cause anxiety and panic attacks as well.
You know what, Dr. Hotze, that's a great point. And just recently I was talking to a couple of women who called our center, and they said, I didn't used to be like this. I didn't used to feel anxious or have panic attacks, and now I do. And that speaks to what you were talking about. As a woman changes and goes through menopause, she starts to experience these symptoms that she didn't have before.
Exactly.
And that's very disturbing.
So if you have the symptoms of anxiety and you end up going to see a conventional doctor, they are inevitably going to place you on some form of anxiolytic drug, anti-anxiety drug, antidepressants. They'll give you sleep medication. All these are very addictive medications that can cause a host of side effects that can even make your symptoms worse, because the antidepressants and the anti-anxiety medication, all those, well, antidepressants can cause you to have outbursts of anger, a significant and dramatic increase in suicidal thoughts. It causes you to gain weight. If you weren't depressed before now or anxious before now, you got all this weight on you, plus it's loss of romantic moods and inclinations. So it doesn't help the problem. It really harms the problem. It doesn't address the underlying cause. Nobody feels anxious because they have low levels of anti-anxiety drugs or antidepressants or sleep medication. So what's the appropriate and proper treatment? It's simply to replenish the hormones. So what's the solution to anxiety attacks and maybe depressed moods or mood swings, it's not pharmaceutical drugs. They're attended by a host of serious and deleterious side effects. They never address the underlying problem, which is hormonal decline and imbalance. So as you mature, as your hormone levels get low, kind of like a glass of water that's low. You're at the restaurant, you got a low glass of water. What does the waiter come by and do? He comes and brings you more water. He fills up your glass so you have a full glass of water. This is what you need to do as your hormones decline and become imbalanced. You need to replenish them and balance them out. And that's what we specialize in doing here at the Hotze Health and Wellness Center, using natural bioidentical hormones, which means the hormones are biologically identically the same as the hormones that God put in your body and you made when you were younger to begin with, when you felt well. So we simply replenish the hormones, and that has a dramatic effect. So that may be supporting your adrenal gland with cortisol. It may be supplementing you with natural desiccated thyroid hormone. It may be replenishing your progesterone if you have estrogen dominance. It may be in males, giving them testosterone. And in females, as you go through the change of life, you would take some natural bioidentical estrogen hormones. These have a profound effect and a natural effect on restoring you to your youthful self.
Thank you, Dr. Hotze. And I just want to appeal to all those people out there who do suffer from anxiety. You don't have to suffer. You can address those symptoms naturally. It's just so easy to pick up the phone and give us a call. It would be a privilege to serve you. We have served over 31,000 people. We'd love to do the same for you. Our number here is 281-698-8698. That's 281-698-8698. It is a pleasure to have you join us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.